Hi, welcome back to Health Matters. I'm your host, Sunita Mohan. So today we have a two-part show. We're going to be talking to Dr. Arun Narang about dentistry and aging. And then second half, we're going to work out. Last week I talked to a personal trainer. It was just more talk. Now we're going to put it into action. So get ready for the show. So now we'd like to welcome Dr. Arun Narang back to the show. Welcome back, Arun.
Thanks, Anita.
So Arun is dental surgeon, very impressive, and president of Toronto Academy of Cosmetic Dentistry. That's great, Arun. So
Thanks.
Today we're just going to focus on aging and bone loss and gum loss and what you do at your office.
And prevention.
And what you do to make us look healthy as we get older.
Sure.
Okay.
Sure, absolutely.
So you have something, so what we want you to do is just kind of hold it up and show it to our viewers.
Yeah.
So you want to start off with, as we age, what happens to our bones?
Well, it's just an interesting model, and it just shows the effect of tooth loss.
Right.
So, if somebody had a healthy lower set of teeth, their lower jaw is going to have a really nice thickness from the lower border of the jaw to the teeth. And, this is what happens with aging if you don't have teeth. You know, somebody who's lost their teeth, or is wearing a denture, and it could be a full denture, could be a partial denture. If they don't have some form of tooth replacement, because that's the only thing, like an implant is the only thing that's going to prevent tooth loss, not dentures, not a bridge. The only thing that's going to prevent this kind of bone loss is placing implants in the bone. And that's exactly what happens to the jaw. Over, a few decades, you're going to basically get to a stage where you're losing a lot of volume of bone in your jaw.
So when you're at this stage at the bottom, how old would you be?
Well, you could be, depending on how early somebody loses their teeth.
Right.
Depending on if somebody's losing their teeth in their 20s or if they're losing their teeth in their 40s.
Wow.
This is easily what they could be looking by between their, anywhere from their 60s to their 80s.
Wow.
And it starts getting so bad that then there's, sort of nerve damage that can start occurring because the denture starts pressing on the nerves, and obviously the denture becomes looser and more difficult to manage and to wear. So just one of the type of, things that, we explain to patients in terms of aging. And, the only thing that can preserve your bone to really prevent that from happening if you've gotten to that stage, and we'll talk more about prevention so you don't get to that stage, but if you do get to that stage, then putting in an implant, a single tooth implant, is going to be what really prevents the bone from continuing to recede or drop down.
It's really interesting because we think of, as we're aging, osteoporosis and bone volume, total bone volume in your body, or bone density. That's what everybody talks about.
Yeah.
And people forget about their mouth, because this is all going to change also along with the rest of your body. Yeah. So it's very important that our viewers know that.
Yeah, very important to maintain your teeth,
Exactly.
And it starts with prevention, regular, obviously practicing good oral hygiene yourself.
Right.
And then, having a good relationship with your dentist and or hygienist to keep your gums healthy, and to go in regularly for your maintenance visits and recare visits, or hygiene visits, to clean the gums and keep them healthy, so we don't get to the stage where you're losing teeth, and losing and or developing gum disease, because that's going to be a gradual process where, again, the bone's going to be lost until the roots are visible or the teeth start becoming loose, and we don't want that. We can prevent that.
Right.
So regular cleanings are really important.
I have started getting regular cleanings done. I would let it go for 2 years, 1 year, even though my brother's a dentist. So this is what I used to do. And then now I made it a point that, okay, I'm going to go on my birthday. That's a good way of doing it. I'm going to go in my birthday, and then I'm going to go, you know, because my birthday's in May, so that I know, okay, May, and then I'll go again in the winter. So that way, going twice a year, you think is a great, or more, or...
So, you know, your hygienist will always personalize it for you, but, you know, if you have relatively healthy gums, twice a year would be great,
Yeah.
you know, to go in for a cleaning. Someone who may have less healthy gums may need to go every 3 to 4 months for a cleaning. So we'll kind of tailor make the plan for the individual, just so that, you know, because gum disease is one of those kind of things that it doesn't, the teeth don't hurt until the end stage.
Right.
When they're getting loose, or you're losing so much of the bone volume that the teeth are becoming infected or loose. So, you know, that's why it's one of those things that can creep up on you. And I always tell my patients, you know, if you're skipping, you know, going in once a year, going in every other year, it's going to catch up with you.
Yeah,
it won't, you know, you won't feel it now, but you will eventually feel it, because it'll have a cumulative effect over time. And then you will, you know, possibly develop more problems.
Yeah, and I think that's very important. And you're saying, so as you age, you lose bone volume and you lose gum volume.
Yeah, I mean, so there's things happening on all fronts, you know, like, again, if there's tooth loss, then you're going to definitely have bone loss, you know, and bone volume. And that's why we say, as soon as you can, if you can afford to do these kind of treatments, and they are becoming more affordable. Yes, they are still more expensive, but they are becoming more and more affordable. And sometimes it's like, really, when you think in terms of the value that you're going to get over time, you know, look at it that way. There's really nothing that's going to last as long as a well-placed dental implant. So if you do a bridge, or you do some sort of tooth replacement, but you need to replace it 3 or 4 times over the course of your lifetime, it's going to add up to being a lot more money than having done it the proper way the first time. So, and we start losing volume of our gums too. So these days we are able to do soft tissue grafting and increase the volume of gums and make the gums healthier. If someone's already lost the bone, we can do bone grafting, you know, to restore their volume of bone before they do an implant. So there's a lot of cutting edge techniques and neat ways of being able to bring somebody back to a healthier, you know, dental state, you know, and reverse some of those aging, you know, the phenomena of aging and some of the problems that they're developing over time with tooth loss or gum loss.
That's so important. And now, you know, we have such an aging population, so many baby boomers out there, and I think it's very important to be aware of that. And, you know, once you lose that smile, I think it makes you look older faster. Like, people will start to look faster if they don't take care of their teeth.
Well, see, what happens is, you know, with wear, like, I mean, if somebody is grinding their teeth, or someone is just gradually aging or losing teeth, and then the teeth are shifting or moving, it affects their bite. It affects the way their teeth come together. The lower jaw then tends to overclose or close more than it should, and the corners of the mouth start sagging. And then it starts creating that droopy lip look. And, you know, you think that a facelift's going to maybe solve your problem, or maybe fillers are going to solve your problem, or other things. But really, sometimes it's just you're losing that height of your face, of your lower face. We call it lower face height, or that vertical dimension of occlusion, or the lower part of the face is just beginning to shrink and become smaller. So if we can kind of restore it, or make it go back to the way it was, by slightly lengthening the teeth, or adding a little bit of material where it's needed, or opening the bite back up, we can really make a huge impact or difference on the way someone looks.
And, you know, does it affect the way people chew? Like, if you lose that...
Absolutely, absolutely.
You're not chewing your food properly.
It affects your speech, it affects your taste. I mean, if you're wearing dentures or partial dentures, you have a slab of plastic that's covering either the palate or parts of your gum tissue. There's taste buds in the palate, so
Yeah, right.
you'll lose some sense of taste. It'll definitely affect taste, and even the pressure that you can apply with your teeth when you're chewing and eating. Those are things that we take for granted.
Yeah.
But false teeth like dentures don't have that same kind of bite force that you can apply with them. You can with an implant, or something of that nature, a fixed restoration, but you can't with dentures.
Yeah, it's like that picture you have of a glass, and you take your dentures out at night and you put them in there before you go to bed, and that's
Yeah.
the image I have of
Yeah.
aging.
Yeah.
And you're saying that that's not necessary, has
No, I
to
mean,
happen.
it's not necessary. And, I mean, again, like I said, the least expensive way is don't lose them to begin with,
Yeah, of course, of course.
Maintain them,
Yeah.
maintain the teeth that you have with
Yeah.
prevention and with maintenance. And then if you do get to the stage where things are changing, then try to catch it at an early stage as
Yeah.
opposed to letting it get worse, because it's a domino effect. Then you lose one, and then you can start losing multiple teeth. Don't
Exactly.
let it get to that stage.
Yeah, and that's what I want our viewers to know, that let's do prevention, and times have changed. There's lots of things we can do now.
Yeah.
It's not the old style anymore. And what we're going to do is, after the break, Arun, we're going to talk a little bit more about prevention, and then
Sure.
more about the implants, because I think that is really crucial that our viewers should know. So
Okay.
if anybody has any questions or anything you want to ask Arun, any comments or anything, call us at 848 Live. We'll be right back after this break, and we'll continue with Arun.
Thank you.
Health Matters. I'm Sunita Mohan. Thank you.
The opinions expressed in the following program are those of the participants and do not necessarily reflect those of Rogers or Rogers TV.
Welcome back to Health Matters. We have Dr. Arun Narang talking about dental care as we age, which is really important. I'm learning so many things because I didn't even know that you can actually prevent it, and there's, you know, better options out there.
Yeah.
And you don't always have to look for, you know, it's not going to be dentures eventually. It's going to be nicer smile, and implants, you said, is the best way to
you
go.
know, even for those who may have already lost teeth, still never too late. I mean, you're still going to prevent yourself from maybe getting from here to here, you know, from here to here, or from, you know, here to here.
Yeah.
So even if you've lost some bone volume, but, you know, it's never too late to at least try to do something to prevent it from getting worse.
So for our viewers, what can we do? Like, let's say we are, you know, 50, and so what should you do? Like, there's a lot of people out there that think it's great right now at 50, but sooner or later it's going to start going downhill.
Well,
because it tells what we can do.
I guess, I mean, a lot of times I'll get somebody maybe who hasn't necessarily been in for a while, maybe a few years, maybe 5 years, and, you know, all of a sudden they feel that they have to maybe give their teeth some attention because they've been letting things slide, you know, and we all kind of get to that point at some point. Sometimes maybe we've let things go for a period of time. So, you know, we basically tell them to come in for a comprehensive examination, you know, a thorough checkup of your teeth and your gums, you know, and obviously hygiene, like, you know, seeing our hygienist, or, you know, your hygienist for a good scaling and dental cleaning, you know, to get the gums healthy. Because if they're not healthy, they're going to be red and inflamed, and they're going to bleed easily. And you're going to have bad breath. If they're getting cleaned, the gums are going to be firmer, they're going to be healthier, there's going to be less bleeding. You know, we can work on the home care with them, teach them how to brush, floss, or use, you know, adjuncts like a water pick or different, you know, electric toothbrush, or different things to sort of, you know, kind of bring their home care to a higher level. So that's a good starting point, you know. And then developing like just a comprehensive, like a proper plan for somebody, you know, in terms of sometimes people will have restorations that are aging, you know, maybe old silver fillings, you know, which have been there for 30 years or, you know, a long time.
I think you have people that like that come in.
Well, I mean, again, you know, sometimes the restorations are there. People think that they're going to last forever. They don't. They don't. And nothing is hurting, so they think that it's okay. It's okay. But, you know, we start seeing signs, telltale signs of crack lines in the teeth, you know, or, you know, as those silver fillings are aging, you know, or they'll start getting damage to their own teeth occurring from it. So, you know, we can put together a plan for replacement if it's needed. There's ceramic restorations that we can do in the same day these days. Sometimes little chips or, you know, minor things can be repaired before they get worse. So there's materials for every solution. Like every problem, there's a solution. So it's just coming together with a custom plan for, you know, that particular patient. And everyone's going to have unique needs.
And I also find as we're aging, I find that our teeth are not as white. And, you know, it could be people, you think it would only happen to people who drink coffee or smoke. But I think as we get older, our teeth are not as white.
Well, you know, you've got enamel. Enamels are the covering for the tooth. Enamel's mostly translucent or see-through. The real color of the tooth is being imparted by the layer under the enamel, which is the dentin. That's the living part of the tooth. When we're younger, the dentin is lighter in color. As we start aging, the dentin will start becoming darker because the nerves will recede, and it's going to absorb more tea, coffee, red wine, you know, dark sauces, you know, darker drinks, colas are going to gradually darken the dentin. or like the part of the tooth under the enamel. So when we're doing bleaching or when we're doing whitening systems, whether they're take home, over the counter, or the in-office, that's what we're trying to do, is bring that color back, lighten the teeth, make them look more youthful and sort of brighter and whiter.
Exactly. I mean, that's the main thing. I think to know that as we're aging, and the reason why our teeth are yellowing, or our bone is going to get thinner here and in our jaw. So what can we do to prevent? You're saying
whitening is a cosmetic thing, but you know what? It's a very simple cosmetic thing that can make you feel better about your smile, and make your teeth look more youthful. So, and as long as it's not being overdone, it's very safe. So it's a good adjunct for anyone to kind of sort of restore or bring back their smile a little bit and make it look a bit more youthful.
Yeah, you got a nice smile, Arun. You're maintaining your teeth over all these years. I've known you for so long.
I better be.
So the message is to try to keep your own teeth as you get older.
Obviously, prevention is key.
Prevention is key.
Prevention is key, and it's so simple, and it's the least expensive.
Yeah, I mean, checkups. So at your office, you do, of course, checkups and cleaning, and then you do root canal, gum treatment, as we talked about, dental sealants. What would that be?
I guess those are just coatings that you would put on someone's teeth to prevent them from getting a cavity.
Right, okay.
So we try to do we do a full range of dental procedures, and most dental offices will these days. I'm not just trying to promote myself. I'm here to increase awareness for the general public at large. But there's so much that your dentist can offer to help you to keep your teeth and to help improve your smile and the overall health of your gums and your teeth. And we provide those kind of services at our office. And I like the word biomimetic dentistry, and what that really means is dentistry that mimics nature. So we're trying to develop, use more natural materials in our patients' mouths. Obviously, materials that kind of match their teeth better, but also that are conservative, procedures that mimic nature and make your teeth look and feel good.
Right, and I know that you can also get veneers done too, right?
Yeah, you can get all sorts of, cosmetic treatments done, from simple bonding to veneering teeth, which can be done very conservatively for somebody who doesn't want to really have a lot of, have tooth material removed, because we have, these days, many times we can do prepless veneers, or we can do very, very thin veneers where there's no preparation or very little preparation of the tooth involved. Not every case is amenable to that, but many cases are. And sometimes when teeth are more heavily broken down, then we have to use, crowns. But these days we're also getting away from metal in dentistry, so we can do Emax crowns, which are basically fully ceramic and translucent and very lifelike. And again, mimicking nature more.
Yeah, that's very important. So we have about 3 minutes left in this segment. So anything else, Arun, you want to add about aging teeth and prevention, or what our viewers should go away with on this segment?
Well, I think that, just to recap, if you haven't seen your hygienist for a while, visit her.
Yeah.
Hygiene is so important. Dental hygiene is so important. And there are links now to gum disease and heart disease, gum disease and diabetes, and it's your mouth is the portal of entry for all disease into the body. And if you have a healthy mouth, you have healthy gums, you're going to have a healthier body. And so I think it's important for you to practice prevention. And then if you are at a stage where you've started to lose gum volume or bone volume, then get a consultation.
Exactly.
Consultations usually don't cost anything. And moving forward, then you can do something about it, and don't get to the stage where you are losing,
Yeah,
your bone
exactly.
volume or losing your teeth. Do something about it.
And you have a lovely office. Like going to the dentist now is a treat. I think going there before, people are always scared. Oh my God, I have to go to the dentist, and it was just about a drill, and that's kind of sound. But I think now the way your office looks, it's so gorgeous, like going to a spa for your mouth. I think it's great. So
Thanks.
when it's a relaxed atmosphere, and you're saying come in,
Yeah.
basically for a consultation and see what can be done preventive.
There's
So
a lot
people
of,
know years ahead.
a lot of times people just avoid going to the dentist because
Yeah.
they're so scared. It's the fear of the
Exactly.
unknown.
Yeah.
And we try to ease into treatment for those kind of patients, just so that that we can build their confidence level in us, and they start to feel more comfortable. And then for those that are just sometimes too phobic, we offer sedation services too that help them to be
Exactly.
able to move forward with treatment instead of being a dental cripple and not being able to do anything.
So you, instead of needles, you also offer laughing gas. I have a friend who's scared to go. She asked me, she goes, does Arun, give laughing gas? And I said, yeah, he does. I think he does.
We have all forms of sedation at the office,
Yeah,
from the
okay.
simplest to the most complex.
Okay, so we'll leave at that at laughing gas. Is a good way to end the show. So that's a great thing. There was something else I wanted to touch on. Okay, so you said oral hygiene. Go to your dentist and get it clean. So I've actually realized that also. Going to the hygienist is so important. So important. Because if you go regularly, then it doesn't hurt as much. And then they can keep an eye on your mouth and see what's going on. You get x-rays done. And
Only when they're needed,
Yeah.
only when they're needed. But again, just things are so much simpler and less painful and
Yeah.
easier
That's what
when you practice prevention.
Yeah, that's what I would like our viewers to understand, that it's not scary to go to the dentist. So Arun, we'll have you back again. Thank you for
Thank
being
you.
on the show.
Good
We'll
seeing
be
you.
right back after this break. Health Matters. I'm Sunita Mohan. Thank you.
The opinions expressed in the following program are those of the